Back in Abuja, medical tourism remains an economic conduit, pillaging the resources of most developing countries. Nigeria is not exempt, with limited number of modern intensive care units and facilities capable of providing cutting-edge healthcare services. Our correspondent, Dayo Mushola, however, says one private healthcare facility in Nizamiye Hospital in Abuja is attempting to change the narrative, with its focus now fixated on catering to the needs of high-risk patients.
The concept of intensive care unit in hospitals officially dates back to 1929. Today, innovations in healthcare services combined with emerging diseases are creating compelling needs for increased availability of intensive care units.
What that means is limiting damage that diseases can cause. It means saving more lives. Let me give you a typical example. Somebody that has a cardiac arrest, heart attack. If you don't have a critical care unit, an ICU unit, what will be of that patient? Therefore, it's necessary. And having it available means making healthcare delivery more complete.
Nizamiye Hospital, Abuja, is no doubt one of the few health facilities around repositioning critical healthcare services through the state-of-the-art intensive care unit. Aside the serene atmosphere, are adult and neonatal intensive care units professionally divided into isolation and main units, each boasting of modern facilities such as incubators, infusion pumps, medical ventilators, among other patient stabilizing equipment.
So the difference of the Nizamiya Hospital, our all expatriate doctors for every department, 24 hours in 7 days, they are living in the compound of the hospital, so they are available 24 hours. Within 5 minutes, they can be in the hospital for the emergency issues.
For example, during the examination or emergency, any patient, anything happened, maybe needs urgent caring. If you have a good equipped ICU, you can help. Otherwise, it is risky. Our ICU designed into 4 parts. One part is simple issues, simple surgeries.
Lives have been saved, sufferings have been removed, minimized to minimum for those that have been able to access the services.
Seated on a 24-hectare landmass, the facility, no doubt, is a ray of hope in tertiary healthcare in Nigeria. In Abuja, Dayo Mushola, NTA News.